Often people ask that it is not causing any pain or difficulty, so why should I get operated? You should not wait for the pain and difficulty to arise. If the intestine gets out of the ring or the posterior wall and gets stuck in the inguinal canal, it can result into life-threatening complications, and the surgery will have to be done under an emergency situation. So it is always better to avoid any kind of emergency or life-threatening situation. So once you have an hernia and it is diagnosed, you should opt for repair of the hernia, surgical repair of the hernia. Whether what technique to choose and what kind of surgery to go ahead with must be after the discussion with your surgeon. There are certain patients where certain procedures are suitable, certain procedures are not. So yes, it is a surgical repair, but the exact what procedure should be done upon you must be decided by the surgeon and you after a discussion. But no, you don't have a choice with the treatment. The treatment is surgery. Inguinal hernias can be operated by open method or laparoscopy. In open method, there are various techniques to operate upon the inguinal hernia, where we can use a mesh. There is also techniques where we form the mesh by suturing with our hand, and there are laparoscopic techniques. One is transabdominal and one is extraperitoneal. So in laparoscopy, the mesh is mandatory for the repair of the hernia. There are a few complications of both the open and the laparoscopic techniques, but they are not very common and they are not something which is very morbid or something to be scared of.